What's up, guys? It's Leah here, and I decided to do my research paper on COVID-19. I know that a lot of people are probably sick of the topic and didn't choose it for that very reason, but I chose it for the opposite. Um, I'm a journalism student, and so I enjoy doing projects on things that are current and looking for things that have current sources that are constantly changing, where I can constantly learn new information. So that's kind of why I chose COVID-19. It couldn't be more prevalent in our lives than it is right now, with cases rising, bars closing. My work may be closing again soon, and so it's just so prevalent and so real, and I like writing about things like that as a journalism student. So I started off in my paper just talking about the timeline of COVID. Obviously, there isn't a ton of history because it just started in December. The first cases were reported in Wuhan in December, and it became a pandemic in January. It's interesting to look at the timeline and see how things have spread and how it's changed over the course of the past few months, especially when you compare the timeline of reactions and how people have reacted to the disease. And kind of chart the fear levels with the prevalence of the disease, because it's just really interesting to see how we've become less afraid even though it's getting a lot worse. I went into detail about the prevalence of masks and things such as social distancing and what the CDC says we should do. And this can kind of be considered controversial just because it has become political, and a lot of people don't want to follow these guidelines, whether it be because they don't agree with a specific political party or they don't want to be told what to do. So I do go into detail about this and what that means for people that are battling the virus, those who have recovered and those who are scared or that are immunocompromised, because it is so real. Hopefully the next few months will be more positive than negative. There is a vaccine that's being worked on, and hopefully it will come out mid-2021. I've seen reports that it could come out as soon as January, but I'm not sure if I quite believe that yet, just because the FDA just have to approve it, and it is quite the process to make sure that it's safe, especially for pregnant women, for children, for people that are immunocompromised, for people that are taking other medications such as antidepressants and things of that sort. So it is quite a process, but I think it's really interesting and something that's really fun to research, even if it is a bit political at times. I also go into detail about how the politics are affecting it and how we can kind of push that aside and just look at the disease as a whole, and how it's affecting our society. So, thanks.